Next up, we have our Director of Medical Affairs at HitLab, Prem Sreenivasan, who will be interviewing Steve Garske, who is the CIO of Pipeline Health, talking about IT security threats in the healthcare system and the future of healthcare IT going into the future. So Prem, please come on, introduce yourself, and we'll have Steve on, and you can introduce him as well.
Yeah, thank you, Jerry. Appreciate it. And my name is Prem Sreenivasan. I want to welcome, a warm welcome to Steve Garske, who is our guest today. And Steve is Chief Information Officer for Pipeline Health and manages all the hospital-wide information. So welcome, Steve.
Thank you very much for having me.
So please, we are eager to learn about your journey and your interests. So would you please help us with some introductory remarks?
Sure, absolutely. Thank you again. So been a CIO for over 15 years now and absolutely love the job, although the job has changed quite a bit over the last decade and a half. And what I really enjoy though is building IT teams, and been able to do that at several different locations, and started my CIO career at Children's Hospital Los Angeles a little over 15 years ago. And great organization, obviously in pediatrics, it's a completely different environment, and really learned healthcare through Children's Hospital and thoroughly loved it. Was there for 6 years. We rebuilt the team, we insourced, actually was able to finish my PhD at that time, which was a lot of work as well, and actually wrote my dissertation on insourcing and outsourcing in healthcare IT. And so was able to apply a lot of those learnings to our Children's Hospital team as well in IT. Won a bunch of awards. The team is just phenomenal. And I actually got a little bored, so I decided to leave and went to a hospital in Pacific Northwest in Coeur d'Alene, Idaho, and 5 different hospitals across the Pacific, and also 33 plus clinics. And so same thing, built a new team. They were completely outsourced. We insourced a good portion of it and put them right on the right track going forward. So great team, won a bunch of awards there for that team as well, and then decided to go back to California and went to Verity Health. And that's where I met my current CEO, Andre Soran, who is wonderful. And stayed there for about a year, and then Children's Hospital CIO reopened and they asked me back. So I was there for 5 years, rebuilt the team, put a lot of the processes and technologies back in and upgraded everything that we were there, and got bored again. So now I'm at Pipeline Health with 7 hospitals across the US in Chicago, Dallas, and Los Angeles, and rebuilding a team there and absolutely loving every minute of it. A lot of work, but really loving it. So that's a real quick background.
Seems like a lot of fun and a lot of very interesting efforts in each of these different locations, probably with very different focus as well.
Yes, absolutely. So the focus has changed, especially in the last 5 to 7 years. As you all know, so much of it is about security now. And so everything that we do on the IT side revolves around that security aspect. And so just 10 years ago, I didn't even have a security team. I just had a few people that would manage that, but now we have 30 plus people in each team to be able to manage that security. So that's probably the biggest change.
That's great. So in your journey, as you build these sustainable, high-performing teams, any thoughts on how to, for the audience in terms of how to build them and retain them?
Sure. So everywhere I go, I start with my assessment, and that assessment is pretty basic. It's people, process, technology. And then I've added a couple other areas, which are security and data. And so I always start with people though. And it's absolutely imperative that you have a very strong IT team, and those people are critical. And what I look for in those people is not just a technology background, but also people that can actually interact with the clients and doctors and nurses. And so I often walk into very stressful organizations that have had a lot of problems with IT, and I just start with the team. And as I build the team, then things they start to become fixed. So that's exactly what we're doing at Pipeline as well right now, is rebuilding that team, and so far so good.
That sounds great. So you did allude to the role of security and the impact security has in the more recent years. Any specific recommendations, any takeaways that you would like to share on that front?
Yes. So when you are rebuilding a team, you not only have to look for that technology background and the customer service background and hard workers, of course, but you really want to ensure that everything you do, from implementing a new application to upgrading a new system, start with your foundation and really build that network to where it is security based. And so there are multiple components to this. So a couple of things that we've done in just recent past that have touched the end users is everyone's doing social engineering, but we do this to a different level. We actually had to put some teeth behind it and had some policies in place that really gave them 3 opportunities to fail if they do click on a link, if they do visit websites that they shouldn't be. And so what we did is the first one is a warning, second one is management is informed, and then third, it could lead to termination. And that's how much more we've had to push this on the security side. And then basic things like passwords. Now we're going 15 character complex with, you never have to change your password. Now that's the trade-off. But then we're also going heavy on biometrics and multiple other systems. But I'd start with that network, and that's really where we've been most successful.
That sounds fantastic. So one of the topics that do come up is the IT cost management and some of the concerns that as a CIO you may be facing. Perhaps some remarks along those lines?
Sure, it's a constant, I hate to use the word battle, but it often is. So IT across most organizations now consume the majority of capital and operating, but mostly capital in those organizations. We're always upgrading things and trying to make sure that we stay ahead. And by doing that, though, you have to really focus in on building relationships with the other senior executives and the board, because you're constantly going back and asking for additional capital. And so that's where I try to really form those relationships. And by forming those, then you can translate, why do we need a new network? Well, if you want to be hit with ransomware or something else, you have to go through that whole process of explaining why this is so important. And so that is a battle. And often organization, especially in healthcare, is razor thin margins. So you have to really ensure that you are staying on top of this and then hiring the right people. Instead of quantity, you want quality, and then take care of those people.
So that sounds great. So you covered a number of very important points. I was looking at this and trying to, perhaps you could identify how you see the future of this healthcare IT progressing, perhaps from your vantage point, that would be appropriate for this audience.
So I think IT in general and most organizations are relatively taking over organizations. So I don't mean that in a bad way. I mean it in the sense that IT touches everything. And so we have teams for ERP or EHR, for security, for apps development, for everything you can touch within the hospital, and also biomed. So clinical engineering is also reporting up through myself, and everything is integrated now into the EHR. What we're trying to do is to ensure that these systems work well with our physicians and nurses, because they spend so much more time now on the computer, and they're obviously not spending as much time with their patients, which is a huge deal. So we're very excited about what's coming in the future as far as AI, ML, everything associated with making and automating all of our nurses and physicians areas that we can, and making the data available to them, but in a format that is useful to them. And that's what's happened over the last few years, is we're starting to turn that corner where it's much more useful, because in the past, it's just a big data dump and everything is there in front of them, but it's hard to weed through all of that. And so those are probably the biggest areas that we're looking forward to, is to be able to make sure that we have that usable data in a great format, but also applying artificial intelligence and machine learning, and also RPA, which is a robotic process automation area, which we're working on in multiple different areas across the hospitals to really free up staff. Since we can't hire new staff, we have to free those that are there to be able to work on other areas. So those are the main parts of that, and futuristic areas that we're looking at right now. Now, AI, ML, RPA are not necessarily futuristic. It's mostly about the application of those technologies.
Any other takeaways that you see in the other areas like consumer health or consumer products or any finance and so forth that you think may also support some of the points that you just raised?
Sure. So we look at the retail side often to be able to see what we can do to keep up. And healthcare is very different. I think people think that we should be able to just do the Walmart or other type of system where it makes it so much easier to do it. And I agree in some respects, but healthcare is so much more complex. And so one of the areas that I think that needs to be solidified is really associated with the combination of all of your health records. And so that has not happened yet. And when you go to one doctor at one system and then another doctor at another system and trying to combine those records in a format that is usable for your third doctor who may be at another system, it's because of the competition within healthcare. It's just everyone is working within their own EHRs. We need to be able to combine all that. I think of Amazon often because I do so much shopping in Amazon, and I really find that we are trying to get to a model that is much more centric to the client and to the patient, as opposed to the other way around. It's mostly about the hospitals right now.
Do you see, some possible support in advancing this through regulatory changes? Do you see any of that coming together in the near term or in the next 5 years?
If I counted how many times the administrations have changed in the last 15 years, as well as I've been in IT for 30 plus years, and the initiatives associated with that have really not materialized into something that is substantial, I am not going to rely on regulatory. What we have to do is really determine how we're going to treat the patient across the healthcare system of the US, and whether that be another private entity that comes into play. However that happens, we have to do it. Standardization is really critical, and it's a major issue. And it's something that we haven't been able to resolve yet, but hopefully we will be able to in the future.
Oh, that sounds fantastic. So there's a lot of questions in the chat. I'm sorry, Steve, we probably won't be able to go through many of it. But I think one point that you could leave us with is, one is, how do you become a CIO?
That's a great question. So it's been an interesting road, and I started off on the outsourcing side. So I worked for Computer Sciences Corporation and Perot Systems. Now both have been sold, but I learned how to help the clients through that experience. And I would say that outsourcing experience was critical in becoming a CIO. And if you don't have the patients and their families and the doctors and nurses as your focus, first and foremost, not about IT, but about them, then you won't succeed as a CIO. And what I did is I built relationships with the C-levels at the hospitals that I worked for. And I left Children's because I was outsourced with CSC at Children's, but I knew the CEO and the CIO, the current CIO and CTO and COO and everyone, and had really good relationships. I left, and then they asked me back as the CIO because I knew everything associated with it. So that was the main way that I was able to become, but there's obviously a lot of other educational pieces. I have 2 masters, a PhD, and also try to make sure that I build those relationships in order to do that.
Well, thank you so much, Steve. It was wonderful to chat with you and hear your insights. We look forward to welcoming you back to the session. I think there is so much more content that we can ask of you, and the audience truly enjoyed this conversation. So thank you one more time.
Thank you so much. Thanks for having me.
Yeah,
So
wonderful.
over to you,
Steve.
Jerry.
Thank you very much for coming on, and thank you, Prem. It's an honor to have you both on. Prem, go and fetch yourself a cup of tea and get yourself ready for the next segments you're on, and we'll see you then. So thank you, Steve and Prem, for a great discussion. So you budding CIOs who are in the audience, please reach out to Steve if you have any questions about becoming a CIO.